Hi, everyone. If you're watching this, chances are you've experienced it. That gut-wrenching moment a doctor looks at you, hears your symptoms, and doesn't believe you. Or worse, dismisses you, suggesting it's all in your head or just anxiety. It's infuriating, it's heartbreaking, and it's unfortunately a common reality for many of us living with chronic and often invisible illnesses. Today, we're going to talk about advocacy, not just finding your voice, but how to use it effectively when you're already exhausted, feeling unheard, and battling disbelief from the very people who are supposed to help you. We'll cover strategies for finding the right doctors and how to prepare for those tough appointments. So, what happens when we're met with skepticism instead of support? The consequences are huge, and they can be severe. First, let's talk about the delays. When doctors don't believe you, your symptoms like the crushing pain or fatigue are often written off as being just stress or tied to your weight or simply a mental health problem. Because of this, we face significant diagnostic delays, and sometimes doctors miss the diagnosis entirely. And those delays lead straight to delayed and ineffective treatment because they're treating the wrong problem. We also have to acknowledge that these issues hurt certain groups more than others. If you belong to a marginalized community, this disbelief exacerbates existing health inequities, pushing your health outcomes significantly downward. But the damage isn't just physical, it's emotional and psychological. This is the heavy price we pay. When we perceive medical professionals as being dismissive or patronizing, it creates a profound erosion of trust and agency. We feel invisible and invalidated. We start to doubt the one thing we should always trust, our own lived experience of illness. This is a dangerous place to be. When we feel disempowered by the medical system, we become more vulnerable, more susceptible to falling for quick fixes and scams outside of legitimate medical channels. And finally, this whole experience can be psychologically traumatic. Fighting for belief while you're sick, dealing with dismissive authority figures, it takes a huge toll on our mental health and quality of life. But we need to remember that lack of a diagnosis doesn't mean lack of illness, and a doctor's limited knowledge or bias doesn't invalidate your experience, your body, your symptoms, your truth. They are real regardless of what one person says. So, how do we arm ourselves? Preparation is your superpower when you're facing skepticism. Keep detailed records. Start a symptom diary. Note your symptom onset, duration, intensity, triggers, and what makes them better or worse. Record your daily energy levels, pain scores, and any other relevant observations. The more data you have, the harder it is for them to dismiss. Use an app, a notebook, whatever works for you. This is your evidence. Data makes the invisible visible. Research and prioritize. Before your appointment, research your symptoms. Look for potential conditions. Then, pick your top 1 to 3 most concerning symptoms to discuss. Don't overwhelm your doctor with everything at once. Focus on what's impacting you most severely. Bring a support person. This is huge. Bring a trusted friend or family member. They can act as your advocate, take notes, remember details, and even speak up if you're too fatigued or emotional. A second set of ears and a witness can be invaluable. Write down your questions and goals. Don't go in without a plan. Write down what you want to get out of the appointment. Are you seeking a diagnosis, a referral, specific tests, or symptom management? State it clearly at the beginning of the appointment. Okay, you're in the room. This is where you put your advocacy into action. Be assertive, not aggressive. You have a right to be heard. Speak clearly and calmly. State your facts. If you feel unheard, you can say, I feel like my concerns aren't being fully addressed. Or, I need you to understand the severity of this before we move on. Focus on impact, not just symptoms. Instead of just listing symptoms, explain how they impact your daily life. You can say, I used to be able to work full time, but now I can barely get out of bed for a few hours a day. Or, this pain prevents me from playing with my children, which is devastating. Explaining the impact on your daily life helps doctors grasp the real world severity. Ask for specific actions. If you want a specific test or referral, ask for it directly. You could say, given these symptoms, I'd like to be referred to a neurologist. Or, could we please run a full thyroid panel? If they refuse, ask them to document in your chart why they are refusing your request. Don't let them gaslight you. You are seeking answers for physical symptoms. So, if a doctor suggests it's just stress or anxiety, you can respond. I understand stress can worsen symptoms, but these symptoms began before the stress and are disproportionate to my stress levels. I need to rule out a physical cause first. Let's be realistic. Sometimes, despite all your best efforts, an appointment still goes badly. The doctor is dismissive, unhelpful, or even rude. It's okay to walk away. You are interviewing them to be your doctor. If they aren't a good fit, if they don't believe you, they can't effectively treat you. Seek a new doctor. It may take time to find a supportive primary care provider because of the shortages in Canada, but the effort is worth the wait. You need a primary care provider who is willing to listen and advocate on your behalf. Seek out doctors who have experience with complex or invisible illnesses. Get a new referral. Look for specialists known for specific conditions. Let me share a quick story. My husband was dealing with a bad cough, shortness of breath, and chest pain. Months had passed, and he still hadn't gone in to see a cardiologist. His primary care doctor told us to be patient because he thought my husband's symptoms were from high blood pressure alone. But we knew something wasn't right. We decided to take matters into our own hands. We sought out a cardiologist ourselves, specifically one who was informed about post-COVID cardiovascular issues. That specialist ran tests the primary care provider hadn't, and guess what? He found a small pulmonary embolism, a potentially life-threatening clot in his lung. The lesson here is simple. When your health matters, sometimes you have to be the one to push the hardest and seek out the right specialist. Don't wait for permission. Seek out the care you need. And another tip, when dealing with a skeptical primary care provider, you can ask a specialist to write a letter to them on your behalf. The benefit here is that it uses the specialist's authority to back you up. Getting that letter from a cardiologist or a neurologist confirms the seriousness of your condition and may be the final push your primary care provider needs to finally take you seriously. Trust your gut. You know your body best. Don't let someone else's opinion make you doubt your own truth. Okay, let's talk about a tough reality. What if your current primary care provider is still dismissive? And because of provider shortages, finding a new one just isn't possible. Don't panic. You still have other options. Option 1. Use other entry points. Since your existing doctor has dismissed you, your strategy shifts. You need to use other medical professionals to initiate a workup. Hit the walk-in clinic repeatedly if you have to. Think of the walk-in doctor as your interim primary care provider. Their main job? is to address the immediate concern. If you go in with your detailed symptom log, they are often willing to order basic blood work or provide a specialist referral just to figure out the next step. The approach? Be clear, concise, and focused. Don't complain about your doctor. Focus only on the current symptoms and their impact. You can ask, I've had severe dizziness and heart palpitations for 6 months, and I need a referral to a cardiologist to rule out postural orthostatic tachycardia syndrome. Or, I've had unrelenting, widespread muscle and joint pain for over a year, and I need a referral to a rheumatologist to rule out fibromyalgia. Visit an urgent care center. For symptoms that are severe or acutely worrying, but not an emergency, urgent care has more resources than a walk-in. They are often quicker to order tests or imaging to stabilize your situation and recommend follow-up. Option 2. Tap into virtual and phone services. Don't forget about technology and your regional services. Virtual doctor consultations. Many areas offer virtual visits. These appointments are often faster to get and can provide you with prescriptions or specialist referrals without needing to find a permanent primary care doctor. Provincial health lines like HealthLink 811. Call your regional nurse advice line. The nurses staffing these lines can offer advice, connect you to local resources, and guide you to the most appropriate place to seek care for complex, non-emergency symptoms. Option 3. Go direct to a specialist. In some systems, or for certain fields, you can bypass the primary care doctor altogether. Specialists without referral. Can you book directly with a physiotherapist, occupational therapist, or psychologist? If your symptoms relate to their field, start there. When I was first struggling with long COVID and feeling totally lost, I found the Long COVID Connect program. It's a 10-week group-based virtual program run by 3 physiotherapists, and 2 of them have long COVID themselves. It wasn't just about information. It gave me practical skills to manage my symptoms and, most importantly, connected me to a community who truly understood what I was going through. Chronic care clinics. Look for centers in your area specializing in complex or chronic disease management. Since these clinics usually require a referral, if your primary doctor won't send one, ask a walk-in or urgent care doctor to submit the referral for you. Some of these clinics allow self-referral for the self-management or education programs they offer, so remember to check their website for this. Option 4. Create a paper trail and hold them accountable. Since you're stuck with your current doctor for now, documenting their refusal is a powerful step. Formal request. Write a concise, formal letter or email to your current doctor requesting specific tests or a specific referral. This forces them to respond formally, and a documented, repeated refusal makes your case much stronger. File a complaint if necessary. If their neglect is truly jeopardizing your health, you have the right to file a complaint with the College of Physicians and Surgeons or the Medical Licensing Board. It's serious, but it's your right to safe care. The most crucial action here is to keep trying different access points, walk-in, urgent care, virtual care, until a medical professional is willing to listen and provide that initial necessary specialist referral. We've talked a lot about your primary care provider and other healthcare resources, but you also need a strong team outside of healthcare, and that means community. When you're dealing with a complex or invisible illness, joining a support group can be a lifeline. But here's the key. Look for a well-moderated group. Why moderation matters. Safety first. In a good group, Moderators make sure the conversation stays safe. They filter out people pushing harmful, quick fixes or treatments that aren't evidence-based. They keep the tone constructive. Knowledge sharing. You get to connect with people who truly understand what you're going through. They can share practical tips on everything from the best pacing techniques to which specialists in your area are actually knowledgeable about your condition. Validation. Most importantly, a good group provides validation. It helps you realize you are not alone, you are not crazy, and your symptoms are real. That emotional support is priceless, especially when you feel dismissed by a doctor. So, do your research, find a group that has clear rules, is focused on empowerment, and lets you both give and receive the support you need. Advocacy when you're chronically ill is exhausting, but it's also empowering. Every time you stand up for yourself, every time you track a symptom, every time you seek a new opinion, you are fighting for your right to health and well-being. Your voice matters. Your experience is valid, and you deserve to be believed and treated with dignity. Keep fighting, keep advocating, and never give up on your right to receive proper care. You are strong, you are resilient, and you are not alone. Thank you for watching. You now have the practical tools to demand the respectful care you deserve. Trust your own instincts and confidently know when it's time to walk away from a doctor who isn't partnering with you. Stop waiting for permission. Go demand the partnership you deserve.